Hi, my name is Jorge Espinosa. My topic about is transcatheter aortic valve replacement with a Ballon, expandable in a low-risk patient. Definition: transcatheter aortic valve replacement (TAVR) with a Ballon, expandable device has emerged as an alternative to surgical aortic valve replacement (SAVR). The trisomy sincere aortic stenosis. 8 is among patients who are at intermediate or high aortic for the with surgery.
Stenosis is a progressive disease, which means it gets worse over time. It's typically measured as mild, moderate, or severe aortic stenosis. As a result of the reduced blood flow, the body does not get the oxygen it needs, which may cause symptoms. Patients who have severe aortic stenosis could experience a variety of symptoms that may be confused with simply getting older, including shortness of breath, fatigue or feeling tired all the time, difficulty walking short distances or exercising, lightheadedness, dizziness or fainting, chest pain, swollen ankles and feet, and rapid or irregular heartbeat. Sometimes when an irregular heartbeat or murmur is detected, it could be a sign of an underlying valve problem. Talk to your doctor about diagnosing the cause of your murmur. It's important to know that there may be no outward symptoms of severe aortic stenosis. If you have been diagnosed with severe aortic stenosis and are experiencing symptoms, the disease can be life-threatening and can progress rapidly. Treatment for aortic stenosis.
Application in nursing. And patients with severe aortic stenosis who are at increased surgical risk. Transcatheter aortic valve replacement (TAVR) with Ballon expandable valves in comparison with an surgical valve replacement has significant low rate of rehospitalization after on-year.
Transcatheter aortic valve replacement procedure is performed on patients who have severe calcified aortic stenosis. Here you see an aortic valve that's not opening well. It's severely calcified and leaflet motion is restricted. So to perform the TAVR or transcatheter procedure, a wire is inserted in the femoral artery. It is threaded up through the aorta and around the aortic arch. And then that wire is passed through the stenotic aortic valve placed in the left ventricle. Following that, a balloon catheter is passed over the wire into the stenotic aortic valve. The balloon catheter is then inflated, opening up the stenotic valve, cracking the plaque, and freeing up the leaflets. That's in preparation for the stent valve or the transcatheter valve to be inserted. The first rendition that you see is the first stage of the catheter going in, and then the second stage of the catheter coming through around the aortic arch, over the wire, and it's going to insert into the stenotic valve. Once the catheter is placed in the valve, the stented valve is ballooned open.
Pros and cons. Pros. Pensi has a lower rate in new onset, extract fibrillation, and has a short hospital stay. Detail of Ballon has the advantage of high armor, relies sensitive and price replacement, however, more security during the procedures. It is a minimal invasion the procedures. Improves light quality and expensive of pension with aortic stenosis. Cons. It is expensive. It is not available in all hospitals. Issue applied in Ecuador. It is a life-saving technique for people with aortic stenosis in the symptoms or street like the cynical area cardiology unit and surgery area cardiology unit and the hemodynamic unit of the hospital Teodoro Maldonado Carbo. Sensi to downside 16. Intermediate and new procedures. Transcatheter aortic valve replacement for aortic stenosis. Doctor in this hospital only has one sign on the valve for intubation with TAVR, which is a core valve with diameter of 26, 29, and 51 millimeter, depending on the site on the aortic rim. Conclusion: Pennsylvania severe aortic stenosis would allow surgical raise, the right of the death, store, or rehospitalization after one year. Is significant lower with TAVR that with surgery. Transcatheter aortic valve replacement as timer for aortic stenosis provides lead function glass of dyspnea and is all associated with this decreased hospital stay. Thank you.